You've taken your newborn baby to the doctor for a routine checkup. There's another mother and child sitting nearby, and her child has been feeling poorly since returning from a vacation overseas. This particular mother has chosen not to vaccinate her child because she's heard that vaccines can cause autism, or she doesn't want all those chemicals in her child's body. Unknowingly, her unvaccinated child has the measles. And this unvaccinated child has just exposed everyone in the waiting area and everyone in the doctor's office to the measles, including your newborn, who's too young to be vaccinated right now. Many of you here today have children, and those who do have either decided to have them vaccinated or to not have them vaccinated. Because of vaccines, most of us young parents have never seen the impact that diseases like polio, measles, or whooping cough, how they can affect a child, a family, and a community. As a registered nurse and a parent, I have seen children in the hospital battle diseases like cancer and bacterial infections that had no cure or vaccination to prevent them. I proudly vaccinate my children, and I stay up to date myself to keep myself, my patients, my family, and my community safe from future outbreaks of diseases gone by. There are many incurable diseases and ailments that can affect our children. If we have the means to protect them and keep them safe by vaccinating on time and per doctor recommendations, then we have to do it. I'm going to explain why we must vaccinate our children and what will happen in the future if we don't. First, I would like to talk about why some parents choose not to vaccinate their children. There are many reasons why a parent may choose not to vaccinate their kiddos. Many parents oppose the idea of mandatory vaccination, meaning they don't want the government to tell them what to do to their kids or their kids' bodies. According to a 2002 report in the Journal of Law and Medicine and Ethics, many parents who chose not to vaccinate felt that their child wasn't at risk of catching any of these older, gone-by diseases. And even if they did catch them, medical science is so great that they would be easily treatable. Parents were actually more afraid of the possible side effects of the vaccination than they were of the actual disease. Many parents also cited religious or philosophical reasons. Currently, there are 48 states that allow religious exemption and 16 states that allow philosophical exemptions. Most of these states do require membership in a recognized religious group, but some states only require an affirmation or a philosophical opposition, meaning if you say you have a strong belief, I believe that my child, we don't do vaccinations, it's my personal belief, then that's all it takes as a philosophical exemption. They found, though, that the higher the number of exempted persons in an area due to religious or philosophical exemption, the higher the incident rates of measles and whooping cough. In a study conducted in Colorado, it was found that children with personal exemptions to vaccinations were 22.2 times more likely to acquire measles and 5.9 times more likely to acquire whooping cough than unvaccinated children. So, coming to a church playground near you, measles and whooping cough. In another study conducted by Christine Parkins and published in the Southern California Interdisciplinary Law Journal in 2012, they stated that parents who chose not to vaccinate were not only putting their own children at risk, but other people's children who were too young to be vaccinated or relied on herd immunity until they were old enough or well enough to be vaccinated. Herd immunity relies on 80% of the community to be vaccinated so that those who can't be vaccinated will be protected by those who were vaccinated because the vaccine has really eliminated the chains of contagion. In other words, because you won't get sick, because others won't get sick, those who are too young for vaccination won't get sick either. Parents who choose not to vaccinate cause two potential problems, according to Parkins. If their child gets sick because they are unvaccinated, the child can expose the whole community to illness. A large number of unvaccinated people creates the risk that diseases will spread, meaning even a child that is not sick who has not been vaccinated could still expose others just because he wasn't vaccinated. So now that we've explored why a parent may not choose to vaccinate, let's talk about why we have to vaccinate our kids. There are many reasons why responsible parents must vaccinate their kiddos. Serious diseases do still exist out there. Polio, diphtheria, measles, these are rare in the United States, but they do exist in other countries. Unvaccinated travelers who contract these diseases and carry them back to the U.S. can cause outbreaks among unvaccinated people. This actually happened in January through May of 2017, according to the CDC. An unvaccinated traveler who was carrying the measles from another country boarded an airplane. This actually affected 100 people over 10 states. Vaccines are proven safe and effective. The United States currently has the safest vaccine supply in history. They are tested extensively and they are carefully evaluated by scientists and medical professionals to determine their safety and effectiveness. And yes, vaccines may be uncomfortable because they are injections, and no one likes to see their child upset or cry or not feel good from a vaccine. But it's a minor side effect. It's not serious, not as serious as the complications that happen from the actual disease that the vaccine is preventing. And serious vaccine side effects are very rare. Vaccinations also mean fewer missed days of school and fewer work days missed for the parent who has to stay home with the child who has measles. Less sick days mean less doctor bills. Many vaccine-preventable diseases can also cause lifelong disabilities, such as polio, meaning a lifetime of medical bills and long-term care, and those bills add up. Vaccinations also protect your family and community due to herd immunity. Vaccines also slow or stop outbreaks by impeding the spread of illness. If the solution to serious and highly contagious diseases such as the measles, polio, diphtheria, and whooping cough is a simple, quick vaccination, then you have to have your kids vaccinated. Vaccines are not dangerous. They do not cause the diseases that they are designed to prevent, and they do not cause autism. Do you remember getting vaccinated as an infant or toddler? Probably not. They are not excruciatingly painful when they are administered. Vaccines save lives, and not just your child's life, but the lives of the people in your family and your community. That's why I say every parent must be responsible and have their children vaccinated if possible. As Benjamin Franklin famously quoted, "An ounce of prevention is worth a pound of cure."